Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about commonly asked questions I get for medication called hydrochlorothiazide, also known as Esidrix or Microzide. Plus, I'm going to share with you some medications you should avoid while taking hydrochlorothiazide. So what is hydrochlorothiazide and how does it work? Hydrochlorothiazide is a prescription medication that's part of a drug class of medications known as thiazide diuretics, or water pills. And for those that may not know, thiazide diuretics are a specific type of diuretic medication that primarily acts on your kidneys by inhibiting the sodium chloride co-transporter in the distal convoluted tubule of the nephron. This inhibition leads to increased excretion of sodium and water in the urine. Hydrochlorothiazide is commonly used to treat high blood pressure, also known as hypertension, and swelling or fluid retention known as edema. This medication is available in 12.5 mg capsule form and tablet form in 12.5, 25, and 50 mg dosages taken by mouth in the morning. What if I miss a dose? If you do forget to take a dose, take the missed dose as soon as possible. If it's almost time for your next dose, skip the forgotten dose and take the next dose at your regular scheduled time, but do not take 2 doses at the same time. When is the best time to take hydrochlorothiazide? Hydrochlorothiazide is a water pill, which causes increased urination. Taking it in the morning is recommended to minimize the chances of nocturnal bathroom visits and interruptions during sleep. It's also recommended that you try to take this medication at the same time each day, as it's much easier to remember to take it that way. What are the side effects of hydrochlorothiazide? Well, like all medications, hydrochlorothiazide has a few side effects. Some common side effects may include increased urination, dizziness, tiredness, weakness, or feeling like you're going to pass out, feeling weak or having low energy, skin more sensitive to sunlight, temporary blurred vision, headache, low blood pressure, difficulty getting or maintaining an erection, or electrolyte imbalance. In the first few days of taking hydrochlorothiazide, dizziness may occur due to its blood pressure lowering effects, but with time, your body will adapt. To avoid falls, it's important to rise slowly from a seated or a lying position. But if you're experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. What are some serious side effects of hydrochlorothiazide? Some serious adverse effects of hydrochlorothiazide that you should be aware of include eye pain or severe vision problems, jaundice, which is the yellowing of your skin or eyes, pale skin, easy bruising, unusual bleeding, specifically in your nose, mouth, or rectum, shortness of breath, wheezing, coughing with foaming mucus or chest pain, dehydration, which could cause symptoms like feeling very thirsty or hot, being unable to urinate, heavy sweating, or hot and dry skin, or signs of an electrolyte imbalance including increased thirst or urination, confusion, vomiting, constipation, muscle pain, leg cramps, bone pain, lack of energy, irregular heartbeats, or having a tingling feeling. So if you're experiencing any of these serious side effects, immediately call your doctor and stop taking this medication. Can hydrochlorothiazide interact with other medications? Yes, it can. Hydrochlorothiazide may interact with certain medications or supplements. So always inform your doctor and pharmacist about any other medications or supplements, including prescribed and over-the-counter, vitamins and dietary or herbal supplements that you're currently taking. It's recommended to avoid using hydrochlorothiazide with medications that could increase your risk of certain side effects, including digoxin, lithium, cholestyramine, or dofetilide. Avoid using over-the-counter medications such as non-steroidal anti-inflammatory medications, including aspirin or ibuprofen. So before taking any anti-inflammatory drug, speak with your healthcare provider. It's important to note that this medication is not recommended for those with allergies to sulfa medications and those with a history of gout. Hydrochlorothiazide has the potential to increase the risk of skin cancer, so it's important to minimize exposure to sunlight or tanning beds. When outdoors, it's advisable to wear protective clothing and apply sunscreen with an SPF of 30 or higher. Additionally, as mentioned, it's important to avoid getting up too fast from a sitting or a lying position to prevent dizziness. To prevent overheating and dehydration, it's important to avoid excessive heat exposure and inadequate fluid intake during exercise or in hot weather. There's lots of information on hydrochlorothiazide, hypertension, and other health conditions on our website, so check out our blogs in the links below. You can even save money with your hydrochlorothiazide prescription by purchasing it from our wholesale price list for only $37 for a 6-month supply. We offer free home delivery and competitive prices. And if you have any questions, just drop them in the comment section below and don't forget to subscribe. Bye for now!